Well, hello, everyone, and welcome back. It's good to be back with another episode of the Mental Health Show. And as always, I'm your host, David Burrows. This is episode number 13. And I have to say, it's been quite a journey having the Mental Health Show. And I know for myself, I've learned plenty of things about mental health. And of course, when we talk about mental health, there's a lot of different directions we could go, and there's a lot of subcategories to that. And we're going to talk about some more of that today. And some of these faces will look familiar to you, and we're going to introduce some of them. We've got one new face here with us as well. But Shannon Bishop, let's start with you. Hello.
Hi, I am Shannon Bishop. I work for Chatham-Kent Children's Services as a STAT crisis counselor, and I also participate in social media events like this.
Awesome. Thanks for being here again, Shannon. And Suzanne McLean from Sinclair Child Youth, welcome to the Mental Health Show.
Thanks, David. Thanks for having me.
You're welcome. And talk about your role with your organization.
So I'm a director at Sinclair Child Youth Services. I've worked there for numerous years, mostly as a social worker, but most recently as a director.
Awesome. Thanks for joining us here. And Megan Walker, welcome back as well. Remind everybody who you are.
Hi there, my name is Megan. I am the Mental Health Promotion Specialist at Canadian Mental Health Association, and I'm also one of the single session therapists at Access Open Minds.
Right, well, welcome back again, and we appreciate all of your time here today. Obviously, we've had that word that's come around in our lives in the last almost a year, and things have changed, and then we were opened up for a little while, and now at the time of putting this video out, we're back in lockdown in our areas. Megan, let me start with you right now, as we kind of got used to adapting to things, and things loosened up a little bit, and back here we are. How have things changed again for your services?
I will say, I think this time around, it hasn't changed as much as it did the first time. The first time we had lockdown, we weren't anywhere near using any virtual services at all. So the last quite a few months, we've been adapting and kind of pros now at the virtual methods of care. So now that we're back in the second kind of emergency stay-at-home order, we're basically continuing on providing virtual services as well as still meeting in person as needed. So not as big of a drastic change as it was the first time.
A little more comfortable this time around because we've had time to adapt.
Exactly. A little bit more of a pro on Zoom, so that's always great.
Right. And Suzanne, I'll come over to you, Sinclair Child and Youth, sort of the same question. How could you respond to that?
And my response is going to be similar as Megan's. We remain open during this emergency order, so our services really haven't changed this most recent time. We remain open to serve the mental health needs of children, youth, and families in Lambton County. Obviously, as Megan mentioned, back in March 2020, that was a more drastic change. We went to virtual counseling, and we do continue to do virtual. But we don't want that to be a barrier to services. So if anyone can't access virtual, you just need to call in, and we can problem solve that with them.
Yeah, it's fantastic. Really, I was having a conversation with someone the other day, and I said, could you imagine if this happened in the 80s or even the 90s, when we didn't have FaceTime and Messenger and all, look how we're handling this right now. Things could have been a lot more drastic, I guess, if you will. So we're kind of fortunate. And Shannon, I'm just going to assume, similar response, right? Everybody's adapting still, but not as drastic as before. And interestingly enough, I want to bring this up. We were talking before we started the recording about the weather, and it's actually been pretty mild considering the time of year that it is. It's a little cold, but does weather affect mental health? Shannon, do you want to take that one?
Yeah, I think it does for sure. And we know that January 18th, I think it was kind of known as Blue Monday. And so that tends to be kind of, the Christmas rush is over. We're kind of in winter. The sun's not out as much. The days are kind of longer and darker. And it does affect mood for sure. And so I think we have to be aware of that. We're We're in a pandemic, we're in the middle of an emergency stay-at-home order, and we're in the middle of winter. So it's just the last lockdown seemed a little different in that, people were outside and you could put on your flip-flops and didn't really require a lot of protection from the weather. And I just think, yeah, it is different this time.
And what about the long term of all of this for everybody? Have your agencies looked at this and went, wow, we may have to look at, even when we can get back out to walking around normally, if that's even a word anymore, and hugging perhaps, and physical contact, all that stuff. Are your agencies still looking at continuing these services? And how's that going to look? Who wants to? Megan, we'll come back to you.
Yeah, I think this has provided us kind of like the kick that we needed to expand our service delivery. Like Suzanne said, even prior to the pandemic, in-person appointments weren't always easily accessible for everybody. For me here, I'm in Chatham-Kent, and it's a really rural community, and transportation's a big issue. So we know that we've missed people in the past because of the way that we were primarily providing services. So I think this has provided us the push that we need to continue on with this kind of hybrid model of service delivery to hopefully meet the needs of those in the community in whatever way works best for them.
Right. Yeah. Suzanne, anything you want to add to that?
Yeah, just what Megan said. We had talked for years prior to COVID about how to get virtual counseling up and going, mainly to meet the needs of our clients within the county. That had a hard time getting into our building to access services. I just want to add that, like Megan said, we had a kick. We had to come together really quickly with virtual counseling. However, I know our clinicians have taken the ball and run with it and have done some training in virtual. And the things that they're coming up with are exciting, actually. Being able to offer virtual playrooms for the kids, things like that.
Yeah. So
I know that they're excited to get that going and continue it even past COVID.
Yeah. Well, we were kind of forced into a corner, right? I don't call it COVID day. I call it someday. Someday we're going to do this and that. And I think for a long time, like you sort of mentioned, Suzanne, that we knew this technology was here, but I think maybe a few of us just kind of said, yeah, but I don't want to learn something new. I don't want to, I don't want to do that thing. And then someday showed up, and here we are. And it's really forced to be creative, like you're mentioning the playrooms, et cetera, right? And Shannon, what about your organization? New ways of doing things too and being creative?
Yeah, very similar to what Megan and Suzanne said. We likely will keep an aspect of virtual services even beyond the pandemic. We're finding that for some families it works really well, and it helps to reduce those barriers, like Megan was saying, of transportation and getting to the office. So we're also offering many groups, or trying to offer some groups, and some other kind of drop-in type services for youth in our community virtually. And we are finding that it is working well.
Yeah, fantastic.
Yeah.
Well, speaking of online, there's a lot of resources out there, several online resources. You've all shared many. But let's, I'm going to come back to you, Suzanne, and maybe you want to talk about Anxiety Canada and a few others that you've mentioned as well.
For sure. One of the ones that I know our staff, our clinicians use the most with clients is anxietycanada.com. It used to be Anxiety BC, but when I searched it, it came up Anxiety Canada.
Okay.
So they've obviously changed it now. And it's just a great website that offers some coping strategies for both youth and parents.
Yeah.
So that one's a helpful one. Sorry.
Yeah, no, I was just going to say, I kind of wonder, like, if we'd had to deal with this before all this technology, because I sometimes have a picture in my mind of, we talked about the rural community and maybe those who lack transportation to access these services. But there's people at home by themselves. They're not living with anybody. Maybe they're introverted more than we, so to have that device, I guess, is something that is being utilized more, and these types of online resources. Do you get people reach out and say, where else can I go? Like if in the middle of the night I want to reach somebody, are people asking that question? Are they aware that this is available?
I think for sure. I think clinicians talk with clients all the time about online resources. The one you're showing right now is a parenting website that some clinicians find helpful. And even prior to getting involved with the clinician, our intake workers as well offer online resources as ways for clients to access some help on their own when they are at home.
Yeah. And mindfulness for teens, let's kind of touch on this one a little bit as well.
Mindfulness for teens is, again, just some coping strategies. Mindfulness is all about skills for living in the moment and being able to reduce stress, calmness, just to manage some anxiety in the moment.
Yeah. And one that's been around for quite some time, of course, the Kids Help Phone and kidshelpphone.ca. And one of the things I like seeing about this, and I know it's been some time now, they've added the whole texting feature now to be able to do that, because obviously that's a new way of communicating. And what kind of things can we expect from Kids Help Phone? Like, is it all online, or it's phones, or can anybody call?
Sure. Sorry. Yeah, for sure. I don't have a whole lot of experience with Kids Help Phone. The feedback I've heard is that it's helpful for kids. The texting definitely is a big piece of that for youth.
Yeah. Sorry, was somebody going to say something?
I was just going to say there are some resources on their website as well that parents and families and even youth can go on and print off tip sheets or just get information about certain topics like bullying, for example. So they do have a pretty user-friendly website as well.
Yeah. I like how you mentioned parents in there, because, we're talking about the youth and the teens and resources for them, but parents are going, help! We, even before all of this, there was no books really written on how to raise your children. I mean, books might be written, but how to apply these things. And Megan, I want to come back to you for just a moment. And on you mentioned the rural access. Can you talk about the first response team that we've been able to talk about here before?
Yeah, definitely. So our first response team, it's a phone number that absolutely anybody can call any time of the day. So it used to be called our crisis line, but then everybody assumed that I can only call when I'm in crisis. But really, it's kind of like our first point of contact within our agency. Certainly it's there if you are in crisis and need some immediate support. Definitely reach out. We have our Chatham phone number as well as our Sarnia number. But even if you're, needing someone to chat with, want some coping strategies, if you're having a lot of anxiety or worry late at night and not able to sleep, you can reach out. Someone will be there to answer the phone. Or if you're just looking to get connected to any of our services, they're the people that you'll likely meet with first, and they'll help navigate the process for you.
Yeah, a great new service that's seen lots of success, right? Mm-hmm. So, and you sort of touch on another question here. What about the timing of all of this? Shannon, let me circle back to you, and Suzanne, back to you again as well. What if I need help on the weekends? Is there stuff available on the weekends, or what do you suggest, Shannon?
So at our agency, we do have a 24-hour, 7-day-a-week crisis line, but that's often more used for our protection services. So if you're concerned about risk or harm to a child or youth in the community, we also recommend Kids Help Phone on weekends and evenings because they are 24/7 as well. We also have a program, the Child and Adolescent Crisis Program that we run out of the Chatham-Kent Hospital, the ER department. And so if you are concerned and you're in a crisis situation with your child and it involves some kind of maybe self-harm or suicide ideation or attempt, that hospital program is available every day of the week, all year long as well, for you to go in and have an assessment with a social worker just to kind of get a safety plan in place and determine needs from there.
Right. Okay. Suzanne, what about your agency?
Well, definitely the kids' help phone would be something that we would suggest to access during weekends. Our offices are open Monday to Friday, 8:30 till 5, but we get back to you as soon as we can if the message is left. And again, for those crisis situations, the hospital.
Right. Okay. And I like how you mentioned the hospital, because I would guess that all of your organizations have some form of collaboration and relationship with the hospitals. Megan, I'll circle back to you. How does that work from the hospital and then get you guys connected?
Mm-hmm. So anytime, say if somebody went to emerge for any crisis concerns, our mental health first response team actually gets a report back afterwards to do a follow-up call. So, if you have presented to emerge and maybe, like Shannon said, they did a safety plan with you, gave you some information, and then you went home, our first response team would call you back the next day to check in, see how things are going, and provide any other follow-up from there. So it's a really great partnership to help make sure that, people are getting the supports that they need.
Yeah.
And one thing for the first response team is 16 plus. So if you're at the ER and you're 15 and under, it's our agency, Chatham-Kent Children's Services, that does the follow-up, and we'll get connected with you to get services for your family.
This is fantastic to know, because you're all talking to each other, right, on regular basis. There's collaboration happening, and then with the new the first response team, they're all talking, and you're talking with them in the hospital. And it's great that we're putting this out there, because I think there's a bit of a misconception in the community that services are not accessible 24/7. And I think we're kind of disproving that, that it's out there, folks. You need to reach out. But is it fair to say that one of the biggest struggles is getting people to ask for help? Because we as humans, we like to give lots of help. If you ask me for help, I'll do anything for you. But when it comes my turn to ask for help, is that a fair statement to say, Megan?
Yeah, definitely. I think one of the hardest parts with mental health is the stigma that comes with it. And, fear of being judged, or what are people going to think if I reach out for supports? So, in my role as the promotion specialist, where I do presentations and workshops, the whole goal is to normalize talking about mental health and normalize reaching out for help, just like you would if you had a physical illness, right? But yeah, it's a big thing that we see as a huge barrier. And I think we've chipped away at it, but there's still definitely room to grow there.
Yeah,
but it's a difficult challenge.
One of the reasons the Mental Health Show was born with everybody. And Suzanne, what about Sinclair Child and Youth? What kind of things do they do to, I guess, encourage people to ask for help?
Things just as what we're doing here, the Mental Health Show, definitely. Just putting things out on our website, Facebook, getting the message out that we are open and we're available for services. I just wanted to add, just as Megan and Shannon mentioned earlier, that we do have a collaboration with Blue Water Health as well. So our crisis program will follow up after clients have attended the hospital. Sure.
Let's kind of talk a little bit more about that process. So the hospitals put me in touch, let's say Sinclair Child and Youth, and now someone is sitting in front of you for whatever reasons they're looking for help. What about security and all of this? And obviously, when I say sitting in front of you, we're more talking virtually right now, but let's talk about the security aspect of everything. How do I know that Suzanne, if you're my counselor, it's just you sitting there and there's not somebody off behind listening, eavesdropping? Talk about the security aspect of things.
That's something that we go through with each client at the beginning of service. We have an informed consent where we'll go through all those confidentiality aspects to ensure that they know that everything is private. We are keeping everything confidential. We as well do that in terms of checking in with them too, to make sure that their environment is going to work to do virtual as well, that there's not going to be people coming in and coming and going. So yeah, that's that we go through that with them at the beginning of service.
And I would guess that that's the same with everyone else here, Megan, Shannon, right?
Yeah.
Yep.
Yeah. Let's go back to mom and dad for just a moment. You know, it's communication, I would think, in all of this is a bit of a barrier sometimes because we're dealing with often two homes with the youth. Is that right? Access to information, I guess, is a big part of what you do as well. Sharing that information, is there shared with mom who lives over here and then shared with dad who's over here? How does that work? Is that an easy task? Shannon, let's go back to you.
So no, it's not always an easy task. There's kind of a lot that goes into that, and it's very client and family specific, so it looks different for every situation. But oftentimes, for simplicity, I guess we'll just say if there's any kind of joint custody order where kids are going back and forth between mom and dads, and then mom and dad are often able to have that information shared. Now, of course, we have to take into account confidentiality of the youth, right? Yeah. So they may not want information shared, and as long as there's not a safety concern with regards to that information, we would respect that confidentiality on behalf of that youth.
Right, and I like that point that you mentioned. So the youth has a say in what gets put out. I mean, obviously, until it comes to a safety issue. And Suzanne, I'm assuming the same thing, and Megan for your organizations as well. And you guys take that very seriously, right, Suzanne?
Oh, for sure, we do. And like Shannon said, it's hard to go through all the aspects of it because it's very case by case.
Yeah.
But we do our best to work with everyone that's involved to keep them on board, let them know what they can do, what would be best to support their child or youth. I just want to add too, when you mentioned parents are hugely important. Kids don't do well unless their parents are doing well. So definitely during this pandemic, lots of supports for parents because there's lots of stress out there for parents right now.
Yeah. Yeah.
I will add too that at Access Open Minds, we also have a family navigator. So even though Access is a youth hub for anyone 11 to 25, like Suzanne said, you know, the youth isn't the only one affected, right? There's family members, there might be siblings, there's caregivers. So, you know, if a youth is coming in for services, we also help support the parents because we recognize that, you know, they might need someone to talk to. Even if the youth doesn't want to share information with the parent, that's fine. Their services can be completely separate. Our family navigator can meet with mom, dad, grandparent, aunt, uncle, whoever it is, and provide some tips. Like you said, how can you help your child when you get home to kind of continue this growth that they're learning through counseling?
Yeah, because it doesn't stop at the end of the counseling appointment, right? You know, it's got to carry on from there. And well, another reason why we're here on the Mental Health Show, education is a big part of that and awareness. So we're just about out of time, but I always like to go around one more time in case I missed anything to wrap up. Shannon, we'll start with you. Any final thoughts?
I just think Megan, you know, made a really good point, and it just made me think, you know, oftentimes in my work, I'll hear of parents who really want their youth to have services and their child is saying no, right? And so the parents feeling a little lost in that. But we are offering parent support. And so like Megan was saying, you don't have to have your child coming for services to receive that support. We have a one-on-one parenting program. We have a family intervention program. And you just need to call our intake line and we can get you connected with any of those services.
Great. Shannon, thanks again for your time here today, and keep doing well at what you're doing.
Thanks, David.
Suzanne, over to you for final thoughts.
I think it's just really important to let everyone know that we are here. People don't always know where to access services when they're struggling. So contact our center, and you will talk with an intake worker. We can problem solve how to start those services. And typically, after talking with an intake worker, you'll have a single session of therapy right away, where the clinician will speak with you about your concerns, and we'll get a plan going with you on how best to meet those needs.
Perfect. Suzanne, thanks for joining us here today.
Thanks, David.
And final words from you, Megan.
I think pretty much the same that's been said so far.
Yeah.
Just again, reiterating that at Canadian Mental Health, as well as Access Open Minds, we're still open. We're still providing services virtually and in person. We do have all the safety protocols in place. So reach out for supports. We're here and we can help adapt that to what works best for you.
All right. Thanks, Megan. Thanks again to all of you so much, not just for being here, but for what you do in our communities to support mental health. And I'm sure we'll be talking to you all once again. And thanks to all of you for watching this episode of the Mental Health Show. If you have any questions or comments, make sure you put them in the comment section below. And eventually we'll take the time to go through and go back and have a look and try to answer as best we can. And please click the share button so we can create some more awareness about the services in the community. Once again, I'm your host, David Burrows, for the Mental Health Show. Until next time, take care for now.